quality cancer care to our patients requires both medical expertise and the knowledge of the public policy issue that will affect how the cancer care is delivered. For the ESMO Congress 2021, we have prepared 5 outstanding, truly outstanding policy sessions that we invite you to join. Our 2021 policy track begins with 3 on-demand sessions. That means that you can access them whenever is more convenient for you at any time, or beginning on the first day of the Congress. They are on topics that highly impact on your daily practice. The first session is on cancer prevention, which of course is very important because prevention is the most cost-effective long-term strategy to reduce the burden of cancer. The session is chaired by José Martín Moreno, and you will learn about new additional strategy, preventive strategy to add to your daily practice. The second session, very interesting, is on real-world. We focus on real-world evidence. It will be chaired by Chris Booth, and it will provide you with a very detailed perspective on the impact of real-world evidence on decision-making for new drugs funding. So learn about real-world evidence and the process, the regulatory process of drug approval, but also discover the limitation of the evidence which is generated by clinical trials when the data are submitted for the health technology assessment. Then there is the third session, which focuses on a milestone in the European cancer policy, and which is the Europe's Beating Cancer Plan. The session will be chaired by the ESMO President Solange Peters, and you will learn about strategic, influential policies developed by European bodies on beating cancer in the European Union. And also the ESMO, you will learn about the ESMO blueprint to tackle cancer, as well as the strategy, the European Medicine Agency strategy to 2021, the industry perspective and the patient perspective. Then I strongly advise you to mark your calendar to join us on Tuesday for 2 additional policy sessions. So the first session, it will be, I'm sure it will be very interesting, is a controversy session. And I advise you not to miss it because it will be a very lively exchange on the pros and cons, on what is the best timing for molecular characterization of cancer, the molecular characterization of cancer. Benedict Destalem will present views in favor of the earliest timing, and Felipe Reutberg will present views against. So please join us, share your views, your thoughts, your expertise, so that the session can be really a lively one. The second session is jointly organized with the World Health Organization, and it is chaired by Elizabeth de Vries. And it is on the topic of access to meaningful medicine. In this session, you may discover the 10 most important cancer medicines that frontline cancer physicians find most essential. Then you will find out about the cancer medicines on the WHO model list of essential medicine and how cancer medicine can be more accessible, particularly, especially in low and middle income countries. And also very interesting, you may learn about the economic reimbursement model that is being developed by ESMO. So join us for this session and share your questions, your views, your experience, your thoughts in the live Q&A. Attending the public policy session will equip you, it's very important because we'll equip you with what you need to know about critical topics facing oncologists and patients.